Hello everyone, this is my Comms 103 informative speech, and today I'm going to be teaching you guys about what a skilled nursing facility is. Have you guys ever known somebody who has needed extra help after a surgery or a medical procedure? Better yet, have you known grandparents of friends or your own grandparents who have needed extra help as they have gotten older? Well, today I'm going to be defining what a skilled nursing facility is, the services they provide, who works there, and the population that they typically serve. A skilled nursing facility, as defined by Medicare, is a facility that must have at least one registered nurse on site 24/7 to provide care, and they also must be able to properly dispense and store drugs. So a skilled nursing facility can provide a slew of services to their patients. They can provide vents, which are machines that can breathe for patients when they aren't able to breathe on their own. They can provide oxygen therapy for patients who may need a little extra help breathing. So a registered nurse can provide a nasal cannula, such as this one, to help the patient breathe better. They can provide gurney showers for patients who aren't able to stand or walk, but they also need help with their hygiene. They use medication delivery, and they can also provide physical therapy and rehabilitation to patients. In Koscheberger's article, Rehabilitation in the Nursing Home, he explains the purpose of physical therapy. He explains that they have two distinct missions. The first is to regain functional independence, to ultimately be discharged to home or independent living, or to maintain a resident's functional ability. But not only do registered nurses work at skilled nursing facilities, we also have physicians such as MD or DOs that work there. And their job is to prescribe medications and to perform emergency interventions when they are needed. Another group of people that works at a skilled nursing facility are CNAs, or certified nursing assistants, and they work directly under a registered nurse to provide help with bathing, hygiene, dressing a patient, feeding a patient, and also with physical therapy or rehab by walking with the patient with a walker or with a cane. CNAs and registered nurses also can provide vital signs monitoring to patients throughout their stay. They can use a pulse oximeter, for example, to measure heart rate and oxygen monitoring to see if the patient's getting enough oxygen to their lungs. And they can also take lung sounds. Specifically, registered nurses can take lung sounds and bowel sounds to make sure the patient's well-being is maintained. So what's the difference between a long-term skilled nursing facility and a short-term skilled nursing facility? Well, Medicare defines a long-term skilled nursing facility is when your doctor has decided that you need daily skilled care, and it must be given by a skilled nurse or therapy staff. A short-term skilled nursing facility, as defined by Lear in his article, Nursing Facility is Just What the Doctor Ordered, is when care is transitional and is designed for patients not ill enough to remain in the hospital, but also not ready to be sent home. So a short-term skilled nursing facility could be for patients who have just had surgery and need 24/7 monitoring before they are sent home. So both skilled nursing facilities, as defined by Medicare, need to be able to dispense and store drugs. So the reason they need to be able to do this is because patients who require diabetic medication, for example, such as insulin or metformin, they need that to be given to them daily so that they are able to maintain their physical well-being. So that is why skilled nursing facilities are required to provide drugs to their patients when needed. So why did we need to learn about what a skilled nursing facility is? Well, going back to knowing a family member or a friend who has had somebody live in a skilled nursing facility or may require one in the future, it's good to be educated about what they provide, who works there, and what services that family member or friend will be getting. And so it is also important to be educated about who works there. That way you know who to be able to talk to that directly affects the care of your loved one. So that is my informative speech for Comms 103. Thank you guys for listening.